scared the out of me. The doctors go undercover to investigate ketamine clinics.
I wanted to see how easy it would be to go to one of these clinics and get a ketamine infusion.
The shocking revelations.
Coercion, false promises. This is absolutely stunning.
Have you used these nasal sprays to get high?
And how the drug could be making its way into a home near you right now.
$70 and I can do it at home.
That's today.
4 years ago, we profiled the drug ketamine's off-label use for depression, and at the time, only a few clinics offered the treatment. But since then, the number of ketamine clinics in the U.S. has exploded by 1,665%. Our investigative producer, Leslie Marcus, reports on the potential dark side of this growing trend.
Ketamine's history dates back nearly 50 years ago when it became a mainstay in anesthesia. But the drug developed a very bad reputation as a dangerous party drug that sent users into a K-hole. Recently, the drug made its way to the silver screen in the movie Hustlers, where Jennifer Lopez and her crew used a ketamine cocktail to drug their male clients. But the drug's off-label use to treat depression is trending, and with zero regulation, there's no shortage of clinics offering this treatment. And these clinics are out of plain sight. You couldn't tell that the building behind me is offering these treatments. So I wanted to see how easy it would be for me to go to one of these clinics and get a ketamine infusion. I just left the first clinic, and after a very basic assessment, I met with the doctor for about 5 minutes, and the front desk offered to treat me with ketamine that same day. This seems all too easy to be able to pop in a clinic and get an infusion, so I'm here at Dr. Mendel's clinic. He's the president of the American Society of Ketamine Physicians, and we're gonna get some answers. So Dr. Mendel, why was it so easy for me to pop into these clinics and I was offered these treatments right on the spot?
I don't know why it was so easy for you. It shouldn't be that easy for you. I would suspect it has something to do with cash flow.
Obviously, you've heard stories about it being offered the incorrect way.
I have. There are people who are really quite committed and ethical and passionate and are doing all that they can to do it right. Then there's a second group who wants to provide ketamine in the clinic, but they don't take any responsibility for care before or after.
At what point do you feel comfortable saying, this patient is a great candidate for ketamine, and I'm gonna give them an infusion?
Before anyone gets treated here, we've contacted behavioral health doctor, usually a psychiatrist, and we have gotten their permission to speak with that person.
The places I went to weren't trying to do that with me
I
whatsoever.
wonder if they were less concerned about your affliction and more concerned about just getting you in for an infusion.
Leslie joins us now with another wonderful investigation. So Leslie, a lot to dig into here. Can you just talk a little bit about some of the revelations during your investigation?
Ketamine can absolutely be a life-saving treatment for a lot of people. In fact, 4 years ago, I produced a show on The Doctors where we featured a woman who was suicidal. She had ketamine infusions, and afterwards, she no longer wanted to take her own life. But since then, the expansion of these ketamine clinics across the country, a lot has changed. And I felt when I went into these clinics that these doctors offering the treatments were almost like glorified drug dealers. Nobody was following up about my previous medical history, doing intake. They were more concerned about getting me in there quickly and getting my money. And these treatments are not cheap. People tried to offer me on 6 infusions.
Like how much?
Yeah, I'm curious.
$5,500 for a set of infusions. Exactly. And then they offered me, I was like, that's a little bit pricey. I don't know if I have that much money to pay for all of this, because remember, this is out of pocket. It's not covered by insurance. And they offered me 10% off. Another doctor, this really stuck with me, said that I will give you the highest amount of ketamine in town. That was his sell. All of this was very disturbing to me, which is why I wanted to do this investigation.
It's like pushing Botox. You get the most units here,
exactly.
So come here. That's crazy.
Yeah, but to be fair, the systemic side effects of ketamine are so much
100%.
more.
And listen, what did you, when you went into these clinics, what did you say was bothering you? What did you say was your diagnosis?
I said that I had some depression, I had some migraines, and they told me they could treat the conditions in tandem. basically selling this as a panacea for everything.
Did anybody ask for a referral or any actual diagnosis from a mental health provider? Did anyone have a therapist on staff or
No,
a mental health
not the
provider?
places I visited. In fact, the intake form at one of the places was 2 pages long, and it had some basic questions about my health, and that's it. And I was shocked.
Legalized drug dealing, that's what it feels like based on what you're telling me right now. And look, having said all of that, you even started this conversation off acknowledging that we profiled ketamine in the past where it can indeed help people. So where do you draw the line? Let's dig a little deeper. We want to bring into the conversation Dr. Stephen Mandel, who is the president of the American Society of Ketamine Physicians. He joins us here, and thanks so much for being here. But also joins us now board-certified psychiatrist Dr. Dominic Sportelli, joining us via Skype from the East Coast. Docs, thank you both for being here, coming at this from different angles. You as a trained anesthesiologist, Dr. Sportelli is a psychiatrist who has spent so much of your career dealing with individuals who are battling mental health issues. What are your thoughts on Leslie's findings during her investigation?
Listen, I want to start off by saying I absolutely support the use of ketamine in treatment-resistant depression. We know that it helps. It's not snake oil. It does work. However, what I'm hearing now is the Wild West of unregulated, non-FDA approved off-label prescribing. What I'm seeing here is coercion, false promises, unregulated claims, no behavioral health intervention, no follow-up, no collaboration. This is absolutely stunning to me, and I'm shocked.
And it feels to me like this is a money grab. Can you briefly talk a little bit about how, okay, ketamine can have a benefit, but what's being charged here, and for the conditions in which it's being used, it feels to me that it's less about treating a mental health problem and more about getting someone's money. Is that fair to say in your opinion?
Dr. Travis, that is so fair to say. And you know what? Unfortunately, greed is going to destroy this. And it burns me personally because I know how hard it is to treat treatment-resistant depression. It's unbelievably difficult. This is a fragile population, a vulnerable population, a desperate population. So think about that. You're going to promise them some sort of cure or quick fix. They're vulnerable. They're going to go for it. And let me tell you something. Look. Doctors deserve to be paid for what they do. There is liability, there's responsibility, there's overhead, but anybody that tells you that this is not a lucrative business is straight up lying to you.
Dr. Sportelli, I want to ask you, during my research, there are organizations offering 2-day intensive training courses for any doctor, nurse practitioner, physician's assistant to administer ketamine in a clinic setting. What are your thoughts on that?
Listen, and I've seen it too. Trust me, I get the emails. Come to our weekend clinic and you'll be a ketamine administrator, and you'll get all kinds of money, right? It's a money-making scheme. I am a psychopharmacologist. I'm telling you, there is no magic drug for psychiatry. Now, we know that ketamine has a very high relapse rate. I mean, some of the studies show 70% after a month, everybody's back to their baseline of depression. If you don't treat these people for their life coping skills and ability to deal with their behavioral health disorder, they're going to come right back. But hey, guess what? That works out really well for these ketamine clinics because people are going to keep coming back because they need it. This is my analogy. Would you ever find an orthopedic surgeon that would do a total knee replacement and say, you know what? You don't need physical therapy. Just get the knee replacement. Don't worry about follow-up. Don't worry about rehab. You'll be all good. If you need anything, come back and see me for more surgery. I mean, that's what it's like. It's crazy.
I want to ask you, Dr. Mandel, because you're the president of the Society of Ketamine Physicians, and you work with mental health professionals when you're administering it, but when you hear Leslie's investigation, does that disturb you that she's able to go to clinics and there's just an intake form she signs and, hey, let's take you back and start infusing you with ketamine, which is an incredibly powerful drug?
Yes, that disturbs me very much. It's totally out of line, inappropriate. These people, whatever their credentials, are not being good doctors to their patients.
So, well, I think what's even more concerning is obviously ketamine is approved for people with major depressive disorder. It's being used off-label for a number of other mental health issues. But you're saying you were told it could treat anxiety and migraines and all of these other conditions where it really isn't indicated.
What is the position of, you're the president of the society, you're the main man. What is your position?
I am the president of the American Society of Ketamine Physicians. I helped to found it. I'm very proud of it. It's the only organization of practitioners who are really devoted to using this medicine for all of its behavioral indications. However, I'm not speaking as for the society, I'm speaking for me. And for me, we have an amazing drug here, which is very broad in its application. It's a great anesthetic. For for several decades, it was the most widely used anesthetic in the world.
Used it in my office.
Yeah.
Okay, it's also a party drug. People get high from ketamine, mostly by putting it up their nose. It's also, and more recently discovered to be an amazing treatment for depression, for suicidality, for PTSD. But I know we can kind of laugh at, oh, how could they be using ketamine for that? How could they use it for anxiety? And for a long time, it looked like maybe it wasn't so good for anxiety. It's turning out to be good.
And so my question is, obviously this drug has really good indications when administered ethically and with the right mental health diagnosis. But how do you reserve it for those situations? I mean, you as the president of the society, how do you propose it be regulated so it's not withheld from people who appropriately need it, but it's also not being really used and cannibalized by these for-profit centers popping up? 1,665% increase in several years. I mean, clearly not all of those people are using it for the right reasons.
Yeah, and I wouldn't think
Many
you're
people
condoning
are-
these weekend courses, right, doctor? I mean, is that safe to assume?
I deplore the weekend courses. You can't become an expert in anything in medicine in a weekend. However, people can learn that. And as the doctor pointed out, people can also collaborate with others where they have a gap in their expertise. And the man or woman who gives ketamine to patients can collaborate with others in making sure that there aren't any gaps. As far as relapses, the drugs given in psychiatry have to be taken, most of them, have to be taken every single day, or you start to have problems of withdrawal. Ketamine is a treatment, not a cure. It's amazingly effective, but it doesn't last forever. We don't damn insulin because even though it worked great yesterday, your sugar's out of control today. No, you have to take insulin again. Why is it so bad that you have to have a booster of ketamine after 6 or 8 or 10 or 12 weeks?
We do have to take a quick break. Really quickly before we go to break, can you let our viewers know the difference in dosing when you're looking at, so if I'm using ketamine in the ER, for instance, to do a procedure, conscious sedation, versus people who are using it to get high versus what you're using to treat someone who maybe has major depressive disorder? What are the...
Sure. The abusers are taking about 1.5 grams a day. When you're sedating someone in the emergency room for a brief procedure, you're probably giving them 300 milligrams.
And what are you giving?
And when I give in the clinic for a starting infusion, they're getting about 40 milligrams, 45 milligrams. It's a huge difference.
And I just wanted to clarify that as people are watching, because you may ask yourself, how can there be a drug that is used as a drug of abuse, used in emergency departments and surgery centers for sedation, and then also used to treat major depressive disorder? Varying doses here.
Let me throw this in. It's varying doses through varying routes of administration.
And that's what I want to get into next, because it doesn't stop in these clinics. There's a ketamine nasal spray to treat depression, but is it being abused? We're going to speak to someone who admits using it to get high after the break.
Coming up,
I just happened to be at a house party, and I saw people using a ketamine nasal spray, not for depression or what it's indicated for, but to get high.
then...